Welcome to Dentists in the Know, the podcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We're pulling back the curtain on the industry, talking to the experts, the innovators, and the everyday clinicians who are out there doing the work. There's no fluff, no filter, and definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical breakthroughs to regulatory curveballs to the latest scandal at the ADA, we're probably already talking about it. And yes, we are bringing the receipts. So whether you're a seasoned doc, a curious consumer, a rep, a researcher, or just here for the drama, welcome to the show. Because around here, we're not just in the loop, we're in the know. So I'm going to bring up two of my best friends in the industry, Dr. Chad Duplantis and Dr. Jennifer Bell. Together, we are the Dentists in the Know. And these are some great people, so don't give them a hard time, all of you out there. Sarcasm is good, but Chad cries sometimes, right?
Right.
He's very easily offended.
Yeah. How you doing, guys? Good to see your faces.
Same.
Good to see yours, too. Good to
How
see
are things?
Shitty, but seeing you cheered me up.
Do you care to elaborate or no?
You're just going to leave it there? You're just going to float it out? They come for the drama, Jeff. They come for the drama.
Just leaving it at shitty. That's all.
Okay.
Right.
Yeah. All right.
Yeah. And
All right.
You know what? Shitty with a smile.
That's self-service.
That's
Something to be proud of.
No, leave it alone. Leave it alone. How's everything going for you guys this week?
Chad, you dropped off a kid?
Yeah, dropped off the kid and empty nesting it once again, and everything is going pretty well. Practice is good. Can't complain. Just tired, but that's okay.
Yeah. Do you find now that you have had an empty nest that having an empty nest is better? Like, you kind of look forward to that seasonal change? Yeah.
I think it's safe to say that my daughter or my son are not watching, so
Yeah.
I'm gonna just throw out a astounding hell yes.
Hell yeah.
Nice.
Yeah. Hell yeah. Don't come back. Don't let the door get you on the way.
I do miss them, but it's nice both ways. It's nice when they're home and it's kind of quiet when they're not here, but we talk to them on a very frequent basis, so we get a lot of updates.
Kind of like they never left.
Yeah, via text, TikTok, Snapchat, Instagram, there's a family thread. Yeah. So there's a lot going on.
Before you know it, they're living back in your backyard again.
Yeah, that's right. Hey, by the way,
ask me how I know.
I'm going to tell a story. This is probably one of the best ever. We're at Jeff's house a couple weeks ago. His son's in the backyard. We're getting ready to go to dinner. Jeff and I are on the couch. Jenny's on the chair. In walks his son in nothing but his underwear.
Tiny whiteys or boxers? I mean, you got to paint a picture here.
They were boxer briefs, and he stops. And
not leaving a lot to the imagination.
He's like, "I'm in my underwear," and Jeff's like,
"No shit,
you're fine. It's just Chad." He's like, "Yeah, okay." So then he stands and talks to us for like 10 minutes before he goes and gets ready.
Yeah. Okay.
It was great.
The Horowitz are a proud bunch.
Yeah.
Despite realities.
Yeah.
Nicely done.
Thank you.
Nicely
Be proud.
How are things with you, JB? Y'all got something brewing not too far away off the coast.
Yeah. Oh, Erin there. But I think she's going to stay at least far enough. She is going to definitely bring in some pretty rough water, I think, to the Outer Banks. They were already starting to show some of the like when that happens, the coastal line just sort of moves inward, and a lot of those houses are kind of already in the ocean. I mean, if you've ever seen,
it's crazy how those
Rodampe Island, and I mean, those houses are basically there until they fall over, and they're not insurable. You can't sell them, so people own them, but they Some of them are uninhabitable at this point, but a lot of them are just there to enjoy until one more hurricane takes them out. Because the island is going, the island will go underwater at some point. It's not going to sustain, I don't think. So it's always interesting when we have those things come by. But guys, I was thinking about you today because you always say I'm super negative, and I have actually been kind of negative for many months now. But I had a really good day in practice today, and that just doesn't happen very often. And no one yelled at me, and so I just wanted to. I had a really big case today, a full lower arch, which those cases are super challenging. You have it all conceptualized in your brain. You've got all the parts and pieces, and it still doesn't matter. Like the things that you don't anticipate are going to slow you down are the things that slow you down. But it went like she was able to walk out with a good outcome, and we're in mid-process. And then another bite rehab case. And I've had a couple of those actually today where they were like combination of orthodontics, restorative dentistry, COIC programmers, bite rehab, full arch type stuff. And you're like, wow, this is what all of these hundreds of thousands of dollars of additional education, I finally am actually putting it into practice in a pretty consistent way. And it was just fun when it's the right patient and the right case. And there've been plenty that haven't, but these particular patients were just really awesome today. And it's fun to be a part of their journey.
That feels good. I know
it does.
Yeah. That's good for you. I love that.
Thanks.
Monday,
one out of every
2 hours taking a tooth out.
Yeah, 1 out of every 364 is not bad.
Yeah. Monday I actually took 2 hours to take a tooth out. It took me until 59 to get to the toughest tooth I have ever taken out. Like literally, I had this flashback moment to oral surgery clinic in dental school. Yep. We had this one professor. He was just such a jerk, and he'd come by and he'd say, "Son, are you going to remove the tooth from the patient, or are you removing the patient from the tooth?" Monday.
That's actually really funny though.
Yeah. Monday, I literally removed a patient from a tooth. Right. Yeah. I have never, ever, ever had to take that much bone away.
Sweating?
It was, there were 2 breaks involved. There were 2, let me just walk out for a second, gather myself, and walk back in here. And
sometimes it's because I'm hot, but mostly it's because I'm mad. Yeah. Because I've done this procedure how many times? Right. Like I walked out on a class 2 not that long ago because I was so angry. I'd gone through like 50 matrix bands and like trying to find the right combination of 2 wedges stacked on top of each other, one sinking down, trying to get the circumferential.
This was like. There is 1 millimeter of bone around the end of this root now.
Yeah, why is this so hard? And you get paid $300 or whatever, $200, and you just 2 hours.
Well, and I was gonna do an immediate implant too.
No, you were not now.
Body implant. I'm like, but literally after this traumatic experience that honestly a hip replacement would have been faster. I was like, yeah, I don't think putting the implant in right now is the right thing to do.
You need a break. And honestly, I need a break. I need to walk away from this situation to forget long enough why you're my patient. And then maybe I'll be dumb enough to do it again.
It's just been that kind of a week this week. And again, in the big scheme of things, not god awful or anything like that. But, anytime we have days like you had, JV, and where we start to feel really, really good about ourselves and like,
tomorrow will be a total train wreck.
I'm the greatest. And it's like, bam. Leveled.
I almost don't want to go to work tomorrow because I know it'll be awful.
Yeah.
I've never understood the phrase that, when somebody's saying it's hard to get information out of them or, if something's hard to do, oh, that's harder than pulling teeth.
Yeah.
You've heard that phrase before.
Yeah.
I've never understood that because usually the teeth that I'm pulling, they're pretty damn easy. All the hard ones are getting sent out. But Jeff, on Monday or whatever day it was, I think you said Monday.
Yeah.
You definitely epitomized that phrase.
Yeah. He could have done someone's taxes faster.
Hey,
It was.
I just, since we're talking about clinic real quick, I got to throw something out there. I was involved in the Smile Architect beta testing program, and like it's, I'm going to say it's very case dependent. And, I found that throughout the beta test program and throughout the, infancy of Smile Architect, I found it to either be you're doing Invisalign or you're doing restorative. You're not doing the two in combination. And so that's the biggest struggle. However, I had just a fantastic Smile Architect case where it was really just like really nice teeth, just kind of like worn down the centrals and the laterals because they were retroclined. And so you're like, man, these teeth are really pretty good for 3/4 of the way. And then the incisal edge is gone. And so I was like, this would be a good case to just move those back. I don't want to prep them too much, but I want to do more additive versus subtractive. Wow. The ClinCheck, the treatment plan, everything was awesome. So I just want to throw a kudos out. I think this is going to, I mean, I know it's a great thing. A lot of people have found success with it, but if you get those patients, it's a great option.
Very cool.
Yeah,
Love it.
it's a workhorse in my practice and has been for a while. This full mouth rehab I did today was the lower arch of a Smile Architect case. We did the upper arch in 24, and then stabilized the occlusion with coist deprogrammer, and then moved into the lower arch today. So I can't say enough great things about it as well. It's been a real good adjunctive. I mean, so funny, really quick to go on that. I saw 2 patients today. The first one this morning was the full mouth rehab that I'm finishing up, and it was a Smile Architect case. And if you don't know Smile Architect, it gives you the ability to pre-plan your orthodontic movement to support a restorative plan. The last patient I saw of the day was pre-Smile Architect, where I did Invisalign, tried to guesstimate where I wanted the teeth, restored the teeth, did more Invisalign to fix the restorative position. And then today I'm now doing vertical buildups because the occlusion is still not, I deprogrammed him to find out he's really not a class 2. It's the wildest case. But anyway, but he's been a class 2 his whole life. If you were to see him in a Ceph with a slight, you would say, oh, he's a class 2. He's actually not a class 2. Anyway, now I'm rehabbing the posterior. And I'm like, man, if I had him at the beginning, if I had just had him at the beginning with Smile Architect, could I have anticipated and solved all these problems? It's now
Different
like 6
story.
years in.
Yeah.
Huh?
I said different story altogether.
Totally.
Yeah.
So I don't know. We're playing Monday morning quarterback now.
That's right. Well, guys, listen, we have, first of all, I failed to mention that Toothy is a proud sponsor of Dentists in the Know now, and we are proud to be affiliated with them. We have a great guest, TJ Gilray, who's with us and waiting in the wings. So I think if we want to get to him, we better let you do some news, JB.
All right. I think
Yeah.
I will keep it short since we went a little long on that. Let's go ahead and talk about a couple of things. The first story, I think Jeff is really going to want to ask me questions about afterwards. But when I read the story, I thought this is not super surprising to me. A study that just came out from the Journal of Oral Rehabilitation found that the use of mindfulness, which is using a lot of psychotherapy and kind of going through meditation, helps with TMD related pain. Now, what they found was they put these individuals through a series of different behavior activities and deep dives. They did the meditations and the sessions for like 1 hour a couple times a week, and then an initial 4-hour deep dive session. And they found that those patients from the beginning of the treatment compared to the end of treatment over a 6-week period or so had significant reductions in pain point locations, in overall discomfort, in functional use, and other statistical data points that they were tracking compared to the placebo group, to come out to say that they found benefit with meditation. But I think the overarching piece of information is, I think this is probably true for most pain disorders and for most pain patients. There's a lot of common characteristics between patients that suffer chronic pain issues, autoimmune disease, psychoanalysis, psychotherapy issues going on, anxiety, other chronic ailments and illnesses, a lot of stress in their life. And so it probably is just highlighting the fact that there's a lot of benefit for mental support for those patients that are suffering from chronic disease. We'll get some intel from Jeff after we close the news session, because I'd love to hear it, especially if the pain is more nerve derivative pain as opposed to maybe anatomical pain or occlusion pain, which would certainly require other types of modalities. But the fact is, they still found an overall reduction in pain perception and pain pinpoint interactions in those areas after going through this meditative process. So it's nice to see alternative therapies that we might be able to provide to patients. Another update coming out of the ADA, a lot of contention coming into this House of Delegates. So we'll definitely be keeping you posted on the updates. We did see where there's, again, additional changes in the hired help of the ADA and a pretty significant $20 million cut in the budget moving into fiscal year 2026 because of endowment issues and revenue generating issues as well. With that being said, they're still trying to do the work of the ADA and to represent dentists and the issues that are currently impacting them. And with that in mind, they are seeking ambassadors to help address workforce shortages. Those letters of interest, if that's an area of interest for you, are due by the end of August 27th to be specific. These would be individuals that want to serve on different task force, be consultants, provide feedback, or just complete surveys, etc., to help the ADA understand the current workforce issues that may be going on for all types of practitioners, whether you're in public health, private sector, a PPO practice, DSO, the Indian Health Reservation, whatever it happens to be that you're participating in. I think they're trying to understand what the current challenges are for each of those sectors, and obviously how that also correlates to hygiene, assistance, FDAs, expanded function, DHATs, all of these different tiers and levels of personnel that we currently have in our practices. So again, if you are interested in that, there's a process that you can find on the ADA's website, but they are looking for help for their workforce issues. That is due, a letter of intent is due by August 27th. Another really interesting story that came out of the King's College of London. I feel like I've reported on them before. I think they're doing some really odd, interesting research. They're maybe pushing some boundaries that we're not seeing at all of the other institutes. They've discovered or are hypothesizing now that keratin, which is found in human hair, nails, and wool, may also be valuable in protecting and repairing enamel. So they're using hair and skin to try to repair teeth to see if they can get reparative benefit. So the hope is that there will be toothpaste and gels and other things that might be available to the public in the next few years. We don't have any products available currently, but who knows? We may be having some keratin paste on the market in the not too distant future. The last piece of information I wanted to share with you tonight was that Dr. Bicuspid, which is one of the many news sources that I follow on a regular basis, just completed a survey and published their results on August 19th, which was yesterday. They were asking for some additional information from their readers about their feelings of the economy and how it's currently impacting their practice. And I'm sure you're not surprised, but as we're heading into the fourth quarter of 2025, they are finding that dentists' stress level and their concerns about economic challenges and the fruitfulness of their practices moving into Q4 and into 2026 is continuing to be one of the top number one issues that they're currently facing. In fact, it was 4 or 5 for most users. So 65% of respondents rated their worry about rising operational costs at least a 4 or 5 out of 5. So it's definitely on top of mind for them and trying to manage all the different areas of increases in operational expenses, including staffing, rent, consumable goods, dental lab fees, and honestly, just the continual cost of onboarding different technology and software and improvements and sort of managing your team and trying to get your practices operating at a high level of efficiency, it's becoming quite a compression on the profitability of the practice. So just validating if that's how you feel tonight when you sit down in your lounge chair and grab your bourbon and sort of prop your feet up for the first time and sort of reflect on today and the things that are stressing you out. You're not alone. It would seem like most of our colleagues are also sitting in the same lounge chair. And with that, that's the news. Is this where
Well, I wish that I could have watched some of the news, but I couldn't. And it has nothing to do with StreamYard switching to Wi-Fi or anything, but lovely StreamYard just decided to lose connection with my camera and my microphone. I reloaded lovely StreamYard 3 times, and lovely StreamYard did not reload correctly. The system had to undergo an 8-minute update. So now I'm back. So thank you, StreamYard. I really appreciate everything you do for us.
We couldn't tell anything, Chad. Yeah,
No.
you were back. You're back when the news ended.
Yeah.
I was back when the news ended. So sorry. That's
Yeah.
where it was. That was a rampage that I didn't need to go on, but I needed to go on. Sorry.
You needed it.
You
You needed to get it out of your system.
Yeah.
So JB, your first story. I think that is such an important message. I mean, serotonin and dopamine are known to be, direct modulators in pain and pain pathology, and so any kind of therapeutic, whether it be psychotherapy, whether it be SSRI use, which has also been shown to be very effective at chronic pain relief, and that's mostly the serotonin piece. But anything, and even meditation, anything that has been shown to even temporarily increase serotonin and dopamine levels has absolutely been an effective therapeutic in the pathways of chronic pain. So yeah, I mean, I think that's a great message that we do need to be talking to our patients, and certainly orofacial pain is one of those things that most people don't ever find the right person to talk to about that, and they're never typically led down the right path. They usually end up at a ENT who says, nope, it's not your ears, or they just end up getting bounced back and forth a lot of places.
Right.
And that's a great message to all general dentists, that anybody who suffers from any type of chronic pain, anything that can jump in and break the chain anywhere is useful. And that's why sometimes even just a temporary splint, Chad and I talked about a case like that, like something as simple as an aqualizer, just something that that decompresses, breaks the pain chain right there, and or the pain cycle. Sometimes that's enough to temporarily increase serotonin and dopamine levels, and it keeps them feeling better ongoing, even though the therapeutic you're using may not be 100% effective. It's still, you've broken the cycle somewhere, and that's the thing with chronic pain. I think that was a great message.
Well, thanks.
Yeah.
All right.
Are we ready to bring TJ on?
I think we should sit silent for another 5
ready.
minutes.
Let's just be super awkward.
Yeah, let's just.
And I'll drink really loudly from my
I'll just go.
Waterloo.
Chad, why don't you introduce our guest? It was
really great to have Toothy as our one show sponsor because they're going to quit us after this. It was really fun while it lasted.
You can't quit us, Toothy.
I'm going to let TJ tell us what Toothy is, but I'm going to tell you a little bit about TJ as you bring him up, Jeff. So TJ is a lovingly referred to himself as a military brat. He was born in San Diego, moved to Hawaii, and then he grew up in Texas after his
Mm.
dad retired from the Navy. So Rowlett, Texas is where he claims to be his hometown. Go Cowboys. That's hard to say these days. TJ is a dog person. He is well versed in dentistry. He played football as a road runner at UTSA, the University of Texas at San Antonio. I know TJ pretty well, but I don't know that I knew that. He was about to enter the NFL draft when he tore his ACL. So he ended up moving to Utah, got involved with SaaS, which is software as a service, specifically within dental. He worked for Social Dental, which rebranded to Banyan. That was his first company. Then he joined Weave, where I met him, and he spent 6 years. And he learned a lot about dentistry, about marketing, and how to be a benefit to dental practices. And that's where his journey took him to join Toothy.AI. And he has learned about dental insurance. He's learned to help with offices. And he says, and the struggles that offices has. And he says that him joining Toothy.AI was absolutely a no-brainer. So TJ, I hope I didn't butcher that too bad. I was trying to read it in the third person rather than written in the first person, because it wasn't about me, it was about you, buddy. And I would sum it up by saying I've known you for several years. We've had some great times together. We landed at a teppanyaki restaurant one time. I'll let you tell that story in a very odd manner, but you're a wonderful person, and it's great to have you here. We're excited to learn a little bit more about Toothy.AI.
Yeah, I appreciate it. I don't think you butchered it too much. The NFL draft part might have been embellishing a little bit, but I'll take it.
Nobody would know. I mean,
Yeah.
seriously, nobody would know. I mean,
We
you
did
had an
too much
agent,
thinking.
right? Yeah.
Exactly.
Lifted by that much.
No, yeah. To touch on the teppanyaki story, I think we were in California, some part of California, but we were just trying to find a place for dinner, and we were feeling teppanyaki. And so we get there, and there's literally 100 people outside of the restaurant. And so we get there, and I'm like, maybe we find another place. And Chad's like, no, we're going here. And I was like, okay. And then we walk up to the front, and as we're walking up there, I'm thinking he's taking the lead. And within 10 feet to the desk, he's like, all right, Gilray, let's see what you got. And I go up there, and I'm like, hey, we had a reservation. And they're like, what was the name? And then Chad kind of took the lead from there. And I can't remember the name you said, but we got ourselves a seat within
like 30 seconds.
Yeah, like it was quick. And we go, and it's actually this like 9-year-old's birthday party that we just joined.
Yeah.
And I don't know what happened, but Chad is like, hey, it's his birthday too.
Oh gosh.
And so of course the guy comes and he gets to sake, and he just starts. He's like, all right. So I open my mouth and I do it, and this is my first time meeting Chad, so I was like, I don't know if this is gonna be too much or not, but I'm gonna shoot a shot. And I just tried to take as much as I could. And it took like it felt like a minute or two, but that was right when that happened. I was like, okay, like this is gonna be fun.
Yeah,
Yeah.
we had a good night. It was a
His
lot.
esophagus is still healing from that scenario.
There was a lot of laughter that night, but we did get free cake and free shots. So
We
there
did.
you go.
You can't
There
complain.
you go. Did you
Yeah.
get to rub Buddha's belly?
Not quite, but I wish.
No.
No.
Is
So
that a thing?
It is. Some of those places, they'll bring the little Buddha statue, and you get to rub the belly.
Oh,
I still don't have any idea what the hell teppanyaki is, because in Texas we call it hibachi, but
same.
So, hey, TJ, tell us a little bit. You can start wherever you want, but if you want to tell us your journey in dental sales and how you landed where you are, and then maybe tell us a brief synopsis or introduction to Toothy.AI, we'd love it, man.
Yeah, absolutely. So, like you mentioned, it all started with Social Dental, and I started as some of your favorite people, cold callers, and we would come in, and then I quickly learned that there were a lot of solutions that could be provided for dental that it just takes time to be aware of. And Banyan was more of a luxury product, but it was a great introduction into dental. What got me over to Weave, and at Weave it became more of a necessity. of a product. So it became a lot more impactful, as people have probably experienced at one time or another with Weave. And like you mentioned, that's where I really able to learn the love for people from dentists, like and office managers, receptionists especially. That was a big thing with Weave being a communication platform. Calling into offices immediately, having receptionists appreciate the product because it had everything to do with patient care and communication and those types of things. And so within that, going to events, meeting people like yourself and other KOLs throughout the industry, it was pretty hard not to fall in love with that kind of work. And so Weave was making a great impact. And then along the lines, AI or Toothy had reached out, and I did a lot of vetting with them because leaving one company to another is going to be a decision, especially being there after a few years and the impact it was making. But hitting on insurance, that was something constantly asked about when I was at Weave. It was like, what do you guys do for insurance? And when I was there, we weren't doing anything. And so when I came over to Toothy, it was a no-brainer because it was automating the tedious parts of the process, and the parts where I think it's fair to say no one really goes and joins a dental practice just to do insurance processing and verification calls and claims and rejections and payment posting, right? It's more about helping the patient care, and ultimately getting that fulfillment. I don't know anybody who gets fulfillment doing the insurance processing part. And so it is exciting to provide a solution for that so that we can, in a way of saying, stop focusing so much on those tedious parts and double down on the patient care, double down on, and inevitably when you care more for the patient, everything kind of falls into place. And so it's been a huge impact. And so with Toothy, what it does, it does the full cycle revenue cycle management. And so it does the insurance verification, and that's not just, the basic eligibilities or anything of that sort. We do the basic eligibilities, full breakdowns. Essentially, you're hiring an insurance coordinator that's doing all of that for you, calling the AI or calling the insurance carriers, and that's where the AI plays a role. We don't want people to be on hold with insurance carriers, and I don't think anybody does. And so we take care of that and minimize the time consumption from that. And one thing to touch on that, there's a doctor that signed up with us a few months ago, talking outside of the business and outside of the practice, the impact that this can make it was like a quick yes for her, because just the last 3 weeks before that, she had missed her, I think he was 5 or 6, but her son's first 3 T-ball games, which broke her heart and broke my heart. And the reason being is because she was on hold with insurance carriers after hours, and they're in California. So the impact it can make outside and inside the practice, and that was within the first 2 months of being at Toothy, and that's where I was even solidified or validated that I made the right decision, because this is making that kind of impact where you're not doing the parts you don't like to do in the practice, which impacts your personal life with your family. But beyond that, the insurance verification, we do the claim submissions, we do the rejections, the appeals, the really annoying parts of that. And we also post the payments, which is a very, anyone who's done payment posting knows how granular and tedious that can be. And we do that. And the way we do that, we combine that with AI, but we also have stateside billing specialists that monitor that. Because if you're going to have AI do 100% payment posting, with all due respect, you're crazy. AI is not there, and I would not trust my business to have AI just run rogue, essentially. And so that's a really comforting part too, because they come from, the least experienced person we have on our billing specialist team is 10 years. So they really know the back of their hand the processes, so they can step in and know when to step in any time. And a few of them, if not most of them, have managers, and so they carry that care for people, care for patients into this job.
So I have a ton of questions, and I'm sure Oh, sorry, I didn't mean to cut you off. I think.
Oh, wait, it's caught up, DJ. I think.
Yeah.
Yeah.
Did he freeze, or were we freeze?
Yeah, it got lagged out for a minute.
I saw my face freeze.
So there's a ton of questions. I know we're all gonna have questions. But the first question, I know this always comes up, especially in our office, where at the end of the day, all of our scans are uploaded to a server and then they're read automatically. Okay. So the first question comes in, how do they get into your server? How do they get into your thing? So how do you all do you all partner with practice management software companies, or do you work with all practice management software companies, or what does that look like for you all even getting the claims to process? That's part one of the question. And then I'm going to let somebody else go because I got a ton more. So
Yeah. Do you want me to answer that first or add a question?
yeah, answer that first. Yeah, that'd be great.
Okay. Yeah. So right now we work with, we don't work with all practice management systems quite yet. We work with Open Dental, EagleSoft, Dentrix, and Dentrix Ascend.
Okay.
And the way we integrate, it's like a 2-minute integration as long as you just let us have access to it. And so within that, we don't change. Like when we first started this, we were kind of contemplating like, do we want to like even be the clearinghouse? And then we were like, well, that was a lot for us to do, and we had not met any doctor who wanted to do that. So we backed that off, and we work with your clearinghouse to submit those claims. And as it's pulling the AI, what it does, it pulls the information and simultaneously produces it into your practice management system. And then when we verify as well, we verify 2 weeks before for those changes, like change of providers, change of B2Bs if they're doing that, change of jobs, which means usually insurance, things of that sort. So the goal there within that is to make sure that you have treatment plans ready and accurate to even give you indirect benefits, like, for lack of a better way of saying, an upsell, where, and I'm one of those patients actually, where, I've had Invisalign, I've had a few things wrong with my gums, and I didn't feel like I was being upsold because they presented in such a nice way and like made me aware of the benefits and the cons of not doing something like that, where that opportunity is a lot, I wouldn't say a lot, but enough times for it to be a pain point missed out on for the patient and the practice when they're not being done accurately and on time.
All right. Who else has a question? Because I got more.
So I have a question then about, because we think about services that we all have, and we had this conversation last week, and figuring out, which subscription services we need. So how does this work? Is this just a true flat fee subscription service, or is there a percentage of the insurance monies that are brought in and posted, or what does the financial side of this look like, TJ?
Great question. So we've broken it up into 2 different products, and because every practice is different, and you might have problems with insurance verification. However, you love whoever's helping with your billing, and so we just want to provide a solution. So with the insurance verification part, it's a monthly rate, and so it's a monthly rate, pretty flat, unlimited verifications. When we first started, we were doing a little bit cheaper than what we normally do with adding on per verification, but quickly found out that made people feel like they would potentially get nickel and dime for those bigger amounts and pay way more than they probably should, frankly. And so we made it just a flat rate of the insurance verification, unlimited verification, so you don't feel like you're getting billed like Comcast every month where it goes up randomly.
Well, that's actually a great thing, because I know that there's a lot of companies out there that will charge for every single verification that's done. So
Right.
I think that's a very valuable service.
Yeah. And then for the billing, and when I say, we call it the billing package, but that includes everything from the claim submission to the payment posting. So that includes aging claims as well, but like rejections, appeals, that's a percentage, just depending on your volume of dentists in your practice or practices. And so we break it up that part where we have some groups that do billing only, and they have some groups that do insurance verification only, and the bulk of them do both.
Perfect.
What are you seeing in the industry now that you've kind of seen behind the curtain a little bit? Is there any motivation on the insurances and billing payment processes part to standardize any of this information to make your company's job easier and potentially more manageable by AI? Like if everything just sort of followed a similar cookbook, you probably could program to that cookbook, but they all have totally different policies and procedures and ways they want to pay and the way they'll receive information and the way they'll give information. And see any opportunity that may change. Are you seeing any movement? And just curious.
No, yeah. So the manager, our director of operations, comes from eAssist firm 10 plus years.
Yeah.
And so she has helped us learn a lot more because, coming into this, to be completely honest, I had no idea what was going on. I
Yeah.
was like, well, this is a different part of the practice because I was always working with the front part of the practice. This is back office type stuff. And learning from her is you want to standardize most of it. And when I say most of it, the parts that could and should be standardized, but at the same time, keep that customized part of it. Because, like, for example, the full breakdown form. I show on every presentation, I show our breakdown form just to emphasize our detail orientation. However, every practice is different, like you said. And so if we were to just standardize that, we would only be able to sell the people that, or work with the people that would
Yeah.
have that specific type of code, which is, I think, almost unrealistic. And so very customizable with that, even to the point where, where you want the information to an extent. And there's some practices I want to here and there. And especially if you work with Open Dental, EcoSoft, and Dentrix, those are 3 different processes within that. And so we're really open-minded on that because at the end of the day, we're trying to be the solution, and we don't want it's not a thing where we won't do it. If we can't do it, we'll let you know, but very rarely is that the case. We can find a way to work with you on that because the goal here is insurance carriers, as we all know, they've made this difficult on purpose because they get more money by not giving you more money, the money you deserve. And so the longer they make that process tedious and longer, the less opportunities you have to get new patients, which is new revenue. It has you focused on the old revenue of work you've already done. And so we're trying to eliminate where you can double down on the new revenue and not focus so much on the old revenue. Let us do that part.
I love that because I think so many of us just need our practices are all so weird and different.
Yeah.
So I think customizable is incredibly nice because it's the challenge when you use so many different software in your practice and you keep getting put in buckets,
Right.
to be like everybody else, and it just doesn't quite work that way.
It just doesn't.
Mm-mm.
So what I love about this particular service is, I love any service that truly solves a pain point in practice. Like nothing is more irritating than walking up to the front office and someone that you're paying, in today's times, a very reasonable amount of money is sitting on a telephone on hold literally for 25 or 30 minutes sometimes. And it's even worse, when you get over to the medical side, the wait times can be even worse. But I know how frustrating that was because, to me, the most important commodity in a dental office are human resources, or those people that are truly there to take care of the patients that are there in front of them. And somebody sitting on a phone for 30 minutes is not the best use of human resources that are really there to be taking care of people.
Yeah, it's unfair to that person too, the actual staff member on the phone, because in all reality, they have to be on hold for 45 minutes, go through probably on average 1.5 reps, like people do get here to there, just to not get the answer sometimes that you're trying to get, that you just waited 45 minutes to, hang the phone up and still have to smile with that frustration in front of a patient that's ready for their service. And so it is exhausting as well, and it can kill morale. That's been told to me by a few practices, not just dentists, but office managers. It kills morale. And then you go home and you're like tired, go to bed, you wake up, do the same thing again, and it's just an ongoing thing. And then that's where things for turnover can turn into, or just culture killers of the practice, things of that sort.
Well, and you control the most important part for all dentists, which they won't talk about. But if RCM doesn't happen, we don't get paid. Everybody else gets paid pretty much until the end. The ship is sinking and you're, shoveling buckets of water out. But the dentist will take it on the chin over and over and over again, to ensure all their debt liabilities, all their rents, all their overhead, and all of their people are paid. And so I don't think dentists focus enough on RCM and its impact on the overall bottom line, and ultimately the profitability of the practice and how fast that money is coming in. So let's talk a little bit about your processes when you're trying to reconcile those accounts and the monies are coming in, things have been posted. What does that look like on your end?
Yeah, so we use something called EDI, which is electronic data interchange. And that's how we're able to read EFTs, and they match the ERAs to make that. So it makes it really easy for us to match what needs to go where when we
Wait, that was a lot of acronyms in one sentence.
And he doesn't even work for the government. That's what's weird about him, because they love an acronym.
The moral of the story is that it truly involves OPP.
Yeah.
You know.
You know me.
You know.
Oh, I love that. I love
You
It
know.
does, man. All
It
those
does.
acronyms. That's OPP.
You just dated yourself like a pair of Jordache jeans, my friend.
Yeah.
I'm with it though.
We
Yeah,
couldn't
you know
afford
me.
DoorDash as a kid. Don't bring it up.
Oh no, so the EDI, the electronic electronic data interchange. If I say it too slow, I have to think about it. That's basically how we are able to read electronically when those payments come in and can post those for you. So it's actually 100% hands off for the practice when those come in. For paper checks, you simply just scan them to us and then we post those. And that's where our billing specialists will come in, because that is manual work. That's not AI, because that's where it gets really granular.
Mm-hmm.
And so when we do that, 99% of our AR comes in within 30 days. The study that we looked into, and this, I mean, you may know better than I do on this one, but the data I looked into is that the average is about 75 days when dentists
I
get
think
paid.
that's probably right.
And that's, for some practices, could be polite to say. And so, and the reality is like I said, that's old revenue that you're still worrying about, and then simultaneously trying to focus on new patients that are coming in, new services, new treatment plans. And so that's what, if you were to move forward with Toothy and use us, the first thing we go after is agent claims, and it's a win-win for everyone, because you're getting your money back and also lets us have an opportunity to show our value right off the bat. And then beyond that, it's really, that's where the whole dynamic of the revenue increase, you have the revenue sitting on this table that you're not allowed to touch, and where that could really hurt. And so we get after that really quickly, because if you're able to increase revenue, that's inevitably going to increase morale, culture, and less stress, and help you double down on the things you signed up for to do this job, which is patient care.
All right. So this is maybe a really dumb question. Okay.
It is coming from you.
Thank you.
So,
For
yeah,
pointing that out.
that was just
I don't
kinda
think you have
redundant.
to. I don't think you have to say that. I think you just say this is a chat question.
Knowing chat, I'm ready for anything.
So, as I was saying,
Yeah.
there.
Sometimes you throw a softball out there and you just gotta.
So the question is, we all, well, most of us at least, I'm sure, have heard AI receptionists and how it all works. So you're talking Toothy.AI, and you keep saying AI this and AI that. I think I know the answer. It's probably like the electronic data interchange. Maybe that's how AI is interpreting it. But what exactly, how is AI working through all of this? I mean, is there someone, is there like a bot calling and then waiting for the answers and then is trained to respond to the answers and then collecting all this data? Or is this all just through data interchanges where you're pulling it? And if that's the case, then how do we know that the insurance is always relevant, accurate, and up to date?
Great question. So AI plays like several ways. So when we go through the portals, go through the websites, the tedious nuances without the phone call, AI is doing that. And so it's reading that information and putting that in there, doing our best to avoid what we all don't want to do, which is be on the phone, even ourselves within AI. But it is an AI, bot, for a better way to say it, that is calling the agent and getting that information, because there is no other way to get that extra information. That's why we have to do those calls. And so, go ahead.
How good is the bot? Does the agent know they're talking to a bot?
No. What's really cool about this is that the founders of this company, they did several research. Our CEO and one of the co-founders actually was a roommate with a dentist who was our pilot practice. So we're able to learn a lot from that, and kind of trialing our AI. It failed the first time, and so what we learned quickly though is that they use AI too. And we not like not me and myself, but the ones that are making those calls, you may or may not. But it's funny, I was talking to a dentist yesterday actually, and she's like, I showed her a video clip, and you can go on our website and I can even provide the link. There's a snippet of what our AI sounds like on the phone, and it sounds like an office manager who's exhausted and doesn't want to be on the phone with you.
It sounds like, this is Phyllis from Dr. Rosen's office.
Yeah.
It's very realistic.
That's pretty funny, but pretty soon we're all going to be talking to bots, and you can't get pissed off at anybody anymore because they, quite frankly, aren't even going to have an ounce of compassion in the brain that they don't have to give a shit.
Right. Well, what's great about it too is that if they're using AI, they are the ones that open the door for us, because it would have been more difficult had they not been using AI, because it would be easy to track. But in some cases, we're not even aware of that our AI is talking to their AI, and so, but beyond that, it would have gathered that information, it puts it into a template, and then that's where it integrates into your practice management system. But yeah, if you, I'll provide a link somewhere that you guys can share it. But there is a snippet where you can really hear like, she's like, yeah, I'm calling to get the information for this patient, and it's realistic. And so. And they don't. We haven't had any flags. We haven't had any problems at all. We've been able to gather it. Yeah, it's been a huge game changer for practices that have been using it. And I'm glad you asked that question, because the uphill battle that we're fighting is that for a few years now, several companies have been, claiming AI, and AI can mean several things these days. And so when we say AI, it's like the AI that you're thinking of, usually in that sense, but it's kind of tainted in the dental industry. The word AI has built up some skepticism. And so that's where showing that phone call, every person who's listening to that call is like, okay, wow, that kind of sounds like my office manager or my insurance coordinator.
So I think that I'm assuming that you all built this AI specifically for Toothy.
Yes, our CTO went in there and really what he did is took the time to learn what that conversation goes like 99.9% of the time, built and prepared to receive the information, prepared for any kind of nuanced questions, things of that sort, because as we know that they try to loophole us all the time.
So the CTO built the AI for the RCM.
Mm-hmm.
And using OPP. But seriously, I mean, from an entrepreneurial perspective, with what you all have built, it's so unique. I think that y'all could spread this in so many directions, and I think there's a lot that you can build upon with this, and I'm sure that your powers that be are kind of already looking into that, because that's pretty incredible that you all built that system. And you need to, I think that needs to be a claim that you need to say, because if it's working, I mean, you guys really need to own that.
Yeah, that's a good point. No, definitely. And you're 100% right. We've already entertained in premature conversations, because coming from a previous company who consolidates a lot, it can become too much if you're not careful. And so that was one thing where we want to master. But the cool thing here is where you start with your system or your service, or the software or any kind of service in general, that's like your foundation. And our foundation is arguably the most difficult part to build AI around.
Yeah, that's exactly. I mean, that's what I'm thinking here. That's powerful.
Yeah, receptionist, like our CTO even said, a receptionist AI is a layup compared to this. However, we don't want to just start doing receptionist stuff if we haven't known for sure that this is going to work, longevity and things of that sort. So we want to prove our own concept, even though it's being proven. We want to make sure that it's going. And then as time goes on, if we get enough requests, that can be enough. But you're 100% right. And that's not a discredit any AI receptionist companies by any means. It's just, as we all know, getting away with an AI on an insurance carrier call that's the most skepticism that I've seen from practices. You're like, does it really work? I heard that they can tell. And that my answer every time is, well, they're the ones that started the war with doing AI. And so we're just combating back.
I love it. I think that's great.
How about can I ask on the
Absolutely,
claims
please.
submission side and the approval and fighting and denials and all that? Let's talk about AI on that end. Are you partnering with some of the AI companies, radiography companies, et cetera, that are helping support on the RCM and diagnostic side? Do you see Toothy involved? Like, how does that all play out on that end of it? Because we also know that I think now 50% of insurance carriers are using Overjet for first pass of claims submission. Like, we know for sure that is happening on their end.
Yeah. So right now, when it comes to like rejections and appeals, we don't necessarily partner with them, but by working through you, and because essentially what you're doing is you really are hiring us like as a service. Like it's definitely software, but we like to focus more on the service part of that. And because we're working through you, it enables us to get through to those systems with AI. That being said, with rejections, like if appeals, things of that sort, those can be so minuscule sometimes that no matter how powerful your AI is, it's just not going to be good enough. And so that's why we had then there were gaps in our system initially, and that's why we hired stateside billing specialists to plug those in, because a lot of times that's still manual work. So to give like a percentage of it, insurance verification is about 90% AI, 10% human. The claim submissions and the posting payments is more about 70% human, 30% AI.
Yeah, that sounds about right.
And how about as far as supporting documentation and what's required? How does that communication work back and forth with the dental practice, say for scaling and root planing and confirming, that there are, probing depths submitted for the insurance companies that of course require that prior to any scaling and root planing, things like that?
Yeah, so right now we're doing daily, weekly reports of information of that, but you also are assigned. So we have our special team that works together, but each account, each practice will have their own designated billing specialist that you communicate in those scenarios to make sure of that, and they're proactively making you aware of that. And most of that is put into either your practice management system, or if you have a different system that you want that put into, we can do that. Because again, going back to that, every practice is different. But within that, yeah, it's able to really handle all of that. And so it's pretty simple, because as long as you're willing to work with us, it makes our job that much easier.
Very cool.
Well,
we've gotten to the end of another hour, Chad.
We have, and I think we all could have a lot more questions, but what I'm going to do is I'm going to ask TJ to kind of chime in on our Facebook page tomorrow. Feel free to post a graphic with the dinky deal and everything, and feel free to just tell us a little bit more about Toothy.AI. If you want to put it in writing, we'd be happy to have that on there. We just really appreciate you being here. So
yeah,
TJ, thanks for being here.
Yeah, thank you.
I'm going to close with this and just say that I don't think that there are too many people out there that could say, I love insurance verification. I love claims being rejected. I love having to write appeals, and I love posting payments. But folks, it's 2025, and quite frankly, you don't have to do it. There are companies that utilize AI to do this for you, and they have a great product that they've built and that they're constantly innovating and building upon. So please look for the link tomorrow to schedule a meeting with TJ. And please look into Toothy.AI for all of those needs that we previously discussed that I just can't even repeat again because they're just so deplorable. Jeez. All right, everybody.
Does all of that in his
TJ,
office.
and have a wonderful evening, everybody. We'll see you next week.
Good night, everyone.
Good
Thanks,
night.
TJ.
Bye. Thanks you.